Obesity is a known risk factor for diabetes, heart disease, and stroke. Now, there's one more major concern about obesity. Mounting evidence shows a strong association between body weight and cancer. With about 2/3 of American adults being at an unhealthy weight, obesity is closing in on tobacco as the #1 risk factor for chronic disease. Let's hear more about the link between cancer and obesity from two leading Maine oncologists.
There have been decades of research looking at the connection between cancer and obesity, and more recently, there has been a connection of obesity with 13 different cancers.
There are many cancers where we are winning the fight. We see the numbers of, for instance, lung or breast cancer or even colorectal cancers are going down. Unfortunately, obesity in the Western world is becoming much more of a problem in terms of the way it relates to many cancers. Cancers of the gastrointestinal tract are projected to increase every decade to the point where they're going to break the top three, both in terms of occurrence and death rate.
One of the most common cancers that I treat is endometrial cancer. The incidence of endometrial cancer has increased as we see the rates of obesity increasing in the U.S. 2/3 of U.S. women are overweight or obese, and while we have over 50,000 cases of endometrial cancer each year, I think it's important to also remember that the cancer is going to be a negligible player in their overall health. Cardiovascular disease remains the #1 killer of women with endometrial cancer. And 1/3 of endometrial cancer patients will die not related to their cancer at all, but related to cardiovascular disease.
There's data to suggest that even children who have higher body mass are going to be at risk for cancer later in life. Once patients have developed cancer and are undergoing therapy, we do counsel them pretty heavily in terms of exercise and diet as lowering their risk of recurrence.
What can you do to help Mainers control obesity? Talk to your patients or clients who have obesity about not only the link to diabetes, heart disease, and stroke, but also the 13 different types of cancer that have been associated with obesity. Include information about the relationship between obesity and cancer in your prevention messaging.
Trying to address the risk factors associated with obesity and cancer is really complex because there's so much that goes into obesity.
We all know that preventing cancer and other obesity-related diseases is far cheaper than any treatment. So let's work together to lower obesity rates in Maine.